Almost with this pharmaceutic itself, we can qualify Gpat. If you are thorough with the entire, it's highly impossible because all 40 questions, the entire syllabus what you have covered, from that they are going to take 40 questions. So every nook and corner they are going to take. The subtopic, if you see, it's around 40 topics. So from every topic, there is a chance of taking one question. So today's discussion, we will discuss about the syllabus of pharmaceutics, and one minor topic, very easy topic we'll take. And from tomorrow onwards, we'll go for the elaborative version of the coaching. So see the topics, these are all very familiar to you. So the topics which are familiar to you, we are not going to concentrate on that. And these many years of experience, what I noticed, they give maximum emphasis on the dosage form and its evaluation methods, additives, and so on. So first I'll read out the topics. Topic number 1, pharmacy profession and then introduction to pharmaceuticals. So here in pharmacy profession, there's a chance of including pharmacopoeias. So this is how, because no books will give you topic-wise materials, we need to collect it. An introduction to dosage form, with that only we are going to start today. And source of drug information, from where we get the drug information. And hospital and clinical pharmacy would have studied like a drug information center or drugs bulletin, drugs today, doctor's drug reference. So we can take it from the journals, from primary and secondary sources, and source of drug information, and allopathic dosage forms. So I don't know why they have kept the allopathic dosage form, because we are not studying about Ayurvedic, Siddha, Unani, or homeopathy, Ayush, but they are given the topic as allopathic dosage form. It's a broad topic. Then crude extracts. This crude extracts, so it's going to be in the topic called pharmacognosy. And last year they had asked one question about how do you extract oil from rose. The extraction of oil from rose is called as so and so. So there may be one or two questions. Then allergenic extracts, biological products in the sense vaccines, blood products, sera, all this comes under biological products. And pharmaceutical plant location and layout. So this is purely regarding the, this is when you study Pharmacy Act or Drug and Cosmetics Act, there the important qualities to be maintained by a pharma industry, Schedule M, that will be entirely covered in this topic. So once you go for that topic, it will be easier for you, where the plan should be, what should be the dimensions, what should be the different areas of pharma unit, location and layout, and pilot plan. These two are go together. And most important topic, pre-formulations. So we cannot go for a formulation directly. We need to do some initial steps, preparation step, or pre-measured steps. We need to go for going for a formulation. That's what collectively called as pre-formulation. And once the formulation is done, the formulated product need to be tested for stability, because to predict the shelf life of the product, to predict the expiry date. And prolonged action, it is extended release, controlled release, or delayed release. We can call that in many names. And that is entirely different from novel drug delivery system. Like we got instant transdermal patches, implants, and torpedo injections, and many are there. We'll see one by one. Ocular drug delivery system, or it may be dental cone, so and so. And GMP and validation. Here, good manufacturing practice. Again, this is going to be connected with the Schedule M of Drugs and Cosmetics Act and validation. Here, validation is going to be for process validation, and for analytical method validation, and for equipment validation. Every machine needs to be validated. So that will be covered in this topic. And packaging materials. So we got different dosage form. Every dosage form, they are packed in different packing material. We call that as primary packing material, secondary, and tertiary. So primary is the one which we cover the entire, the drug is going to be in direct contact with the packaging material. And secondary is going to be the next one, and final packaging, we call it as tertiary. And cosmetics also included over here. This cosmetics is going to be for boys, it's very less, but for girls, it's going to be more. So all the pharmaceutical cosmetics, what we use, or we know they use a term called as cosmeceuticals. So that will be discussed in this topic. And coming to the main topic, dosage forms, necessities, and additives. Here additives, they got different names like excipients, other than active pharmaceutical ingredients. Under that, we can classify that into various dosage forms based on the nature, like solid, liquid, gas, and so on. So, first, if you take solid, no, it will be powders, capsules, tablets. Already, you might have studied this topic. In which year you studied pharmaceutics? All these topics, 6th sem or 5th sem? Still, it is going on. Everyone? Karthik? Karthik?
Sir, yes, sir.
Yeah, in which sem you studied these topics?
Sir, in first and second sem, sir.
So that's all. After that, you didn't touch Sutix till now.
Yes, sir. We studied, sir. We studied, sir. Yes, we
Long
studied.
back.
In third sem, we studied, sir.
Okay,
In third sem, we studied, sir. In fifth sem, we studied, sir.
okay. Here and there, you might have touched the topic. Okay, no issues. Okay,
Yes,
okay.
sir. Yes, sir.
So under solid dosage forms, we got powders, capsules, and tablets. Then when we go for liquid dosage form, we can call that as monophasic, biphasic. Monophasic is going to be all liquid. See here, liquid orals, syrups, elixirs, spirits, aromatic waters, liquid form for the external use like infusions and so on. So, and later biphasic system, suspension, emulsion, and semi-solids, ointment, paste, jelly, creams, and suppositories, and pharmaceutical aerosols called as dosage forms, and ophthalmic products. Ophthalmic products, they have all the category. Even we have liquid dosage form, we got gel, we got drops, and so on. So this is about the syllabus of pharmaceutics. Purely pharmaceutics only I have shown here. Additionally, there are some topics that will be here and there it will be covered. So since it is the first class for pharmaceutics, no, we'll go with the common topic. Common topic in the sense, thought of taking pre-formulation. Before that, we can go for introduction to dosage forms. We might know, but we think that we know all the dosage forms and their names and the route of administration. There are certain dosage forms need to be understood because they are called in different names and the route is going to be different. Okay, so with this, we'll go with the topic. Can you see the slide? Can you see the slide?
Yes.
Okay, fine. So, before going into the topic, can anyone give me the exact definition of a drug? What is a drug? What is the term we use in pharma industry for a pure active drug or for the major ingredient? How do they call that drug? Call that major ingredient?
Active pharmaceutical ingredient.
Active
API.
pharmaceutical ingredient, API. Okay, fine. So what is the second part? Because we cannot administer paracetamol directly, so we need to make it into a dosage form. For that dosage form, we need to add some supporting materials. What do we call that?
Excipients.
Excipients or additives and so on. Okay, fine. Thank you. So definitions: the manner in which drug substances are presented to the market. So in the olden days, no, we had medicaments, but they are derived that the medicaments from plants. So these plants, no, they are not available throughout the year. So what they have done, they have collected that plant leaves or stem or bark or root, they made it into a powder, and later they used the powder directly. So because of the problem of storage and the space, no, now they made that into pills called small spear-shaped component called pills. And some medicaments, no, they are not soluble in water, they made into solidus form. When they are soluble in water, they use a common solvent called water, they made into a decoction, and they call it in the name called kashaya. And some, almost all the medicaments, no, they are not going to be sweeter in taste. So to make it palatable, they added some components to that, and they called in different names. So how why we go for making into a formulation? Because the formulation is not going to be taken, it's not going to be targeted on one age group people. It's going to be a geriatric patient, or it may be pediatric. Pediatric in the sense we cannot ask the child to take a tablet directly. So for them we need to give liquid orals. For adult it's okay, but for geriatric patient, again, if they are unconscious, we cannot go for giving oral dosage form directly. So we need to go for other systemic route. So why we want to convert a dosage form, a molecule, into a dosage form? Point number one, to predict the accurate dose, because many doctors, they give a syrup, but they will not tell the dose that correctly. They will say 1 spoon. The spoon size, no, it's going to be 5 ml. It need to be 5 ml. And nowadays, what happens? All these syrups, no, they come with a cap of 5 ml and 2.5 ml. So point number one, dose. Second one, protection, because all the liquid dosage oral dosage forms, no, they are going to be made with water. So it easily prone to high range of contamination. To avoid this, we go for packing that into a compound, and so it needs to be in the formulation, it should be packed. So I give more protection to the component. Third, protection from the gastric juice. Many times, no, some medicaments may be degraded in gastric pH, but I want the drug to be released in intestine. So I can go for entry coating, whereby the formulation will be targeted towards intestine. Then masking the taste. So we go for masking the taste and odor, and placement of drugs within the body tissues. Implants, sustained release medications. It may be SR, sustained release, Oviran SR, where it's going to release the drug continuously for a once daily tablet. And controlled release medication, same, again once daily. And optimal drug action. So to get optimal drug action, I want the drug to be there in the body for a prescribed dose. An insertion of drugs into body cavities, rectal or vaginal, because many times the pediatric patients, no, kids, they don't like tablets or injections. So for them, for a baby, we cannot force the baby, 1-year-old baby, to take the medicine. So we can use this rectal suppositories, and use of desired vehicle for insoluble drugs. Suppose if the drug is soluble, I'll make that into a solution. If it is insoluble, I'll make it into a tablet or a capsule. Okay, so desirable properties of these forms should to make the, you might have studied this about patient complaints. So once the doctor says that to take this medicine 3 times a day, if it is palatable, if it is appealing, if it is even the flavor what they use, can anyone tell me the universal flavor what they use for all oral dosage forms? This flavor is acceptable by everybody. Even if you go to ice cream shop, no, the basic idea what they have is this one, and later they go for trying other taste and flavor. So what's the flavor they use usually for a oral suspension? Any idea? What's the universal flavor? Flavoring agent. No idea. Do they go
So
for
vanilla.
Yeah, vanilla, one good example. Okay. And most of the time, no, if it is a oral suspension, they go for even peppermint also they go. Peppermint also they go, but vanilla is even universal flavor. And the color also, no, they don't go for darker colors, they go for light yellow or pink. Even the ORS powder now it is sold in the market, no, it is not in the form of powder. To make it more palatable, to make it more attractive, what they do, they give it in the form of like fruity like odor, like apple flavor, pineapple and oranges. So kids, when they are experiencing diarrhea, they will be prescribed to take this medicine like a cold drinks, like a soft drink. So convenient to handle and use in store, stable during storage and use. So I take a product, I'll be storing in my refrigerator. It should be holding its property throughout the shelf life, whatever is prescribed in that medicine, that carton box or in that container. Withstand mechanical shock during transport, because the pharma company may be in Gujarat, but the person who is going to be benefited is going to be in Karnataka. So it needs to travel throughout many states. The person who is going to transfer this or transport this, no, they may be a layman. So there may be wear and tear, dropping the box in a wrong direction. The container should not break. There should not be no wear and tear. and flexibility in different drug strengths. So if I go for targeting a wide range of patients like geriatric to pediatric to elders, I can go for different formulations or different dosage strength. If I have got flexibility, then it is better. Provide expected therapeutic effect and extend drug release. So how far it's going to release the drug, because if paracetamol need to release the drug for 4 hours, then only I can calculate the drug for 3 doses. If it is not releasing the drug, the patient will not get cured. So onset, when it's going to start its pharmacological action, intensity, how far it is going to be potent or less potent, duration of action, how far it's going to be active, and predictable, whether it can be whether we can predict the pharmacological action or whether it is going to work or not, and economical and elegant. So all these things, till now we have tablet as one of the formulation now in the market, because all this category, except for unconscious patient, all these things there is going to be matched. That's why tablets are still existing in this pharma field. So how we can classify this dosage forms? Based on the physical state, we can classify dosage form. Physical state in the sense whether it may be solid, liquid, or gas. All this comes under one thing. Solid is going to be powder, tablets, capsules, and liquid it may be solid, semi-solid. Liquid is going to be monophasic, biphasic, and gases sometimes we use it as aerosols. And route of administration, through which route we are going to enteric or ventral or parenteral, and site of application, where it's going to be site in the sense exactly intradermal, subcutaneous, intramuscular, intra-arterial, intraspinal, intracardiac, then uses, and for what we are going to use, internal use or external use, and so on. Okay, as I told you, based on the physical state, solids, unit solid dosage forms, tablet, capsules. These tablets may be of again tablets that got different categories. I'll upload the materials so that it will be easier for you. So these tablets may be entry-coated tablet or sugar-coated tablet or multi-layered tablet, compressed tablet, double compressing tablet, and capsules, soft gelatin capsule, half the hard gelatin capsules. In bulk dosage form, it may be a powder, need to be reconstituted when you go for taking it internally, like ORS powder, or it may be a dusting powder for exerting its pharmacological action as an antiseptic. And coming to semi-solid, based on the percentage of solid materials what we have, creams, paste, gels, and suppositories. Tell me which component out of these 4 contains more amount of solid particles. Creams, paste, gel, and suppositories. I'm asking you, generally I'm asking you, which one contains more amount of solid components? Creams, paste, gel, or suppositories?
Suppositories, sir.
Okay, so can you tell me the percentage of solid? We cannot call that as suppository because we are going to use a suppository base. That base is going to be more, but when you go for undissolved particles proportion, your paste takes the first prize. And creams, many times creams are basically they are emulsions, which decides whether it's going to be washable or not washable. If it is washable, it's going to be oil in water. If it is not washable, it's going to be water and oil. And gel, again, it's going to be a basic component will be there like alginates where it gets solidified. But once you apply, it becomes liquefied. What we call it as gel sol component. And coming to liquids, we got monophasic and biphasic. Under monophasic, monophasic in the sense it's going to be simple concept, it's going to be transparent. That's all. So under this, we got syrups, solutions, elixirs, linctures, many other. I'll show you the next component. In biphasic, only 2 we got emulsions, suspension. Again, in emulsion, we got oil in water, water in oil in water in oil, or water in oil and water, multiple emulsion, micro emulsion, so on. So in suspension, we got 22 flocculated, deflocculated. Under gaseous dosage form, we got inhalers, aerosols, what we call it as metered dose inhalers, metered dose devices. Coming to the monophasic liquid dosage forms, we got liquid for internal administration, liquid for external administration. The site may not be clear, just listen. So liquid meant for internal use. We know syrups, say a simple syrup, but where it may be medicated syrup. Mixtures, we got many component carbonative mixtures, one example, and elixirs. Elixirs are going to be hydroalcoholic preparations, and link test is going to be a simple example, codeine link test, a cough syrup. So all these medications, no, basically they are going to be sweeter because it's going to be it needs to be palatable for a patient who is taking orally. And coming to the one which is going to be administered externally, not to be taken internally, liquids applied to skin. We got lotions, liniments, collodions, and paints. This lotions, you know, it is going to be applied without friction, liniment with friction, and collodion, they go for applying this for burns and so also, and pain like throat pains. And liquid used in mouth like gargle, we need to just swirl around and we are going to spit it out. Mouth washes and throat pains, again throat pain. And liquid instilled into the body cavities. This is where they might be asking you questions. Douches, ear drops, nasal drops, eye drops, and enemas. Based on the route of administration, again, this may be sounds basic, but just to recollect, I'm showing all these things, and we'll go individual topic. When you go for individual topic, we are not going to touch this. So to get it accustomed to the new topic, I'm taking this. Based on the route of administration, we got oral, powders, tablets, capsules, solutions, suspensions, emulsions, syrups, elixirs, magmas, gels, catchets, and pills. Under parenteral route, solution, suspension, emulsion. Whether you have seen any suspension type parenteral administration anywhere? Suspension type? You heard anything called dry syrup? What is a dry syrup? How does it look? Dry syrup, it's liquid or solid dosage form? Anytime you have seen any antibiotics, the powder form, along with water for injection, supplied with water for injection, skanda. Skanda. The direction will be like this. It should be reconstituted with water for injection and it should be used within 24 hours. So these antibiotics, no, they are supplied in powder form. Before the time of administration, they will add this water for injection. They will reconstitute it into liquid. Then they go for injecting it. This is what we call it as dry syrup. And intra-respiratory, we got aerosols through nasal route, and transdermal. It may be ointments, creams, powder, paste, lotions, and plasters. Intraocular solutions may be the form of drops, solutions, even eye ointments and suspensions. And vaginal suppositories, tablets, ointments, creams, and douches. Intranasal solutions, sprays, inhalation, sublingual tablets, and lozenges. So the good example for lozenges, what we have the market for 1 rupee, like Vicks, Hals. These are hard medicated candy containing high amount of sugar, where they release the drug for a prolonged period because they are made with more amount of binding agent. And urethral suppositories also we got. Based on the site of application, skin, ointments, cream, lotions, eye, lotions, ointments, and creams, tooth powder, toothpaste, even dental cones, hand creams, lotions, hand washes, food, creams, ointment, hair clear. These are all things we are going to study in the cosmetics. Hair creams, hair lotions, shampoos, hair fixing, or gel, hair dyes, nasal solutions, sprays, even nasal cones also we have, and uses internally. All preparations except external preparations going to be internal, and external preparations, ointment, lotion, so on. Fine. Now coming to the important portion, we'll see the definitions, because we might be knowing that knowing these definitions, but to recollect it, I'm showing this. Number one, powders. So whenever you go for reading a definition, no, first you decide what dosage form it's going to be. It's going to be an oral, or it's going to be a solid, or liquid, or semi-solid. So if it is a solid dosage form, start your definition, or the definition will start like this. These are solid dosage form containing finely divided microparticles, or finely divided particles in micron size. So here there are many hidden questions are there. Micron means what will be the size, what will be the mesh size. Any idea about different types of powders? based on that size of the powder? Any one of you? If you want, I will start. Very coarse, then
No, sir.
coarse powder, very coarse powder. Then there should be coarse powder, then moderately coarse powder, fine powder, very fine powder. So this is the category they divided into powders into different category. And the mesh size, no, if it is 20, 40, 60, 80, what's all this? This mesh size indicates what? That 20, 40 men, one example will tell you. For a coarse powder, the mesh size is 20. For a very fine powder, the mesh size is 80. What's the difference here? What may be that for 20 and 80? So in a given surface area, in a given circumference, no, if you got 20 holes, make it blindly, 20 holes, so the holes will be bigger in size. If I make 80 holes, the holes will be very finer. So the hole size, if it is more, the count, if it is more, you're going to get a very fine powder. So it can pass through, all the powder will pass through 80 mesh size, means it's going to be very fine powder. So this micron size and so on, so we'll discuss when we go for the topic. Again, tablets. These are solid dosage form containing medicaments with or without excipients. Most probably we have all these drugs with only excipients. There may be very minimal, because all the drugs, no, they need to be compressed. Can anyone list out very fastly? Karthik, can you give me all the additives of tablet? If you want to know the additives of tablet, no, we need to know about the various stages of making a tablet. So what's step number one?
Binders.
Okay, binder one.
Then we have the excipients.
That's what excipient.
So, like-
Excipients. Okay, one is binder. Okay, to bind the granules. Then
So then we have the coating agents.
no. Now the
After
granules
punching, we go for coating.
granules are bound, right? Now it will be transferred to a hopper.
Yes, sir.
From the hopper, it
Yes,
needs to
sir.
flow freely. For flowing, no, what we call it as glidant. We need to add some glidant. Then after that, this tablet need to be packed or compressed into a tablet. It should come out of the dye cavity without sticking. We need a lubricant for this. Now this same tablet has to disintegrate once it goes into a GI tract. So we need to have disintegrant. These are all basic components. Sometimes we might add some coloring agent. Flavoring agent we don't do for a normal dosage form, normal tablet. For chewable tablet, we may go for flavoring agent. Sometimes we make this tablet into a entry coating tablet by adding shellac or cellulose acetate tablet, because we don't want the drug to get degraded in stomach, because the drug may be acid susceptible. Our acid is not stable in acid. So we will be targeting alkaline pH, like towards intestine. Till that time, I want this tablet to be coated. Or sometimes the drug may not be palatable, it may be very bitter in taste. So instead of film coating, what I'll do, I'll go for sugar coating. So I might have some sugar component as a coating agent. So all these components are considered to be excipients. They are going to be having with or without excipients. Most probably they have with excipients. Granules. Sometimes you might have seen this cold act capsules. Now it is available, I don't know, but you can see the transparent capsule with the different colors of granules. So what they do, they coat this granules with different coating material. So one coating material will get dissolved in stomach, the other one will get dissolved in intestine. So when I go for multiple coating material, I'll get the drug to be released for a prolonged period of time. The capsules, drugs enclosed within the gelatin capsule. What gelatin we are going to use? Hard gelatin or soft gelatin? In hard gelatin, we might say that, sir, it's a hard gelatin capsule, but there are many hidden stories about capsules. Even the color of the capsule, no, it gives you some story. Any idea about why they have different colors for a capsule? Kushi? Why they have different colors? Simply they may give some colors for the tablets, or is there any hidden secret behind that? You have seen any antibiotic capsules? You have seen any one of you? What's the common thing you see in all the antibiotic capsules? Dashrath? Ruben, anytime you have seen any capsule in your, even in your room also, you may be finding some capsules. Why antibiotic capsules, either body or the cap? Mostly the cap is going to be colored and the body is going to be white. Why is it so? What's the reason for giving green color? What's the reason for giving blue color? What's the reason for giving yellow color, red color, entire capsule red in color? So there is a reason behind the color what we use for the gelatin. That is a different story. Once I take the topic of capsules, I will explain to you. Fine. So here these are solid dosage form where the drug gets enclosed, a drug was enclosed within the gelatin capsule, which got two components for hard gelatin capsule, a body and a cap. In case of soft gelatin capsule, it's going to be the one which is molded. It's going to happen within a single moment, but in body and capsule component, first the body will be getting filled, then the capsule will be enclosed or made to fit like a snuggie fit. Fine. And catchers, drugs enclosed with the wafer sheet of rice. So these catchers, no, these are not that much used, but they are one of the dosage form. And pills, this is what I told you. Pills, what they do, they take this drug, they had honey or any other excipients, they roll it. They will make it into long strips. Then individual strips will be made. Maybe it may be hand rolled. Now we got a lot of pelletized machines have got. But in olden days, what they do, they roll it using their palm. And finally, because it's going to be a natural medicine, it's not followed for allopathic medicine because we need to be very careful with the dosage form or dose. So a small tablet containing excipients and lozenges. These are hard tablets, mostly sugary tablet or candy-like tablet, which is mostly used for any throat infection like Hals, Vicks, Hajmola, and so on. So not Hajmola actually, Vicks. They have more amount of binding agent that it will not disintegrate very easily. So these are solid preparations containing sugar and gum used to medicate mouth and throat. So mouth and throat since maybe a sore throat, for that I can use this lozenges. And suppositories again, these are solid dosage form because we cannot call that as semi-solid because if it is semi-solid, it needs to be like ointment or paste. It's going to be solid when you remove from the strip. It's going to be inserted into the body cavities. It may be rectal or it may be it's going to be vaginal or urethral. Okay, fine. So these solid dosage forms containing medicaments with suitable suppository basis. So when it is ointment, it's going to be ointment basis. Suppository basis like cocoa butter that inserted into the body cavities other than mouth, like rectum, nose, and ear. Other than mouth, it's going to be inserted into the body cavities. And poultices, solid dosage forms converted into paste-like preparations used externally in the skin to reduce inflammation. So, for example, we can call that as zinc oxide paste. Even the cricketers also, what they do when they come to India, they cannot bear the heat. So what they do, they apply this on their lips or on the cheeks. They apply this zinc oxide paste. So this can be grouped under poultices. And coming to the liquid dosage forms, collodions, as I told you, liquid preparations for external use having nitrocellulose used to protect the skin. Sometimes they may be infected with burn or to protect them from the burn, or they might have lost one layer of skin, or maybe for skin grafting, they go for giving this collodion. These are medicated, that is nitrocellulose compound. And droughts, liquid preparations for oral containing medicaments available in single dose or multiple dose. So these are liquid preparations particularly meant for oral. It may be a single dose or it may be a multiple dose. What is SVP and what is LVP? Any one of you? SVP, LVP? I'll give the clue. S means small, L means large. Now finish it off. Karthik? SVP. I'll give one more clue also. These two are parenterals. Now,
Large volume parenteral.
okay, large volume parenterals and small volume parenterals. Okay,
Small volume.
how do you decide this is large volume and small volume? Up to which volume we call it as small volume? Up to which volume we call it as large volume? There should be some.
So more than 100 ml.
So up to 100
Is
ml,
large
we can
volume.
keep it as okay. More than 100 ml. Any examples you got? More than 100 ml. If it is, what's the name of the compound? How do we call that parenteral? More than 100 ml. NS, DNS. What is DNS? Dextrose, normal saline or normal saline, dextrose 5% solution. All this comes under large volume parenterals. They are said to be called as infusions or irrigation fluids also. Fine, very good. So coming to elixirs, these are liquid preparations for oral containing medicaments with suitable excipients. So mostly elixirs, no, they are called in other names called hydroalcoholic preparation. So alcohol will be in more amount. And there was a product which was sold in the market long back. Now also it is sold, called Woodward's gripe water. Woodward's gripe water, no, in the olden days, no, they didn't check what it contains. But whenever the kids consume this elixir, no, they go for a deep sleep. And later, recently, maybe 5 to 10 years before, they found that it contains alcohol, and that alcohol makes the child to sleep. So now, if you see the gripe water bottle, no, it's literally mentioned as alcohol free. So that comes under elixir preparations, hydroalcoholic preparations meant to be given orally. And emulsions, biphasic liquid dosage form, where one phase is dispersed in another phase. So there will be one dispersed phase or dispersion medium, like oil in water and water in oil. The good example is your milk is going to be a emulsion. So these are biphasic liquid dosage form for oral containing medicaments in which fine oil globules dispersed in continuous phase. So oil globule is going to be dispersed in continuous phase. This way, water in oil or oil in water. Once you go for dissolving it, you will come to know whether it is going to be oil in water and water in oil, which phase you are going to take. Suspension, again biphasic liquid dosage form for oral containing medicaments in which the fine solid particles suspended in continuous phase. Again, here also we got, there it is oil globules, is going to be here, it's going to be undissolved particle. If the drug cannot be solubilized into liquid medium, into a continuous phase, now only choice what I have is go for making it a suspension, go for adding suspending agent, make it into a suspension. And enemas, these are preparations, they are used during the emergency cases. Suppose when the person has taken poison, if I want to make that patient to undergo gastric lavage, I use this enema, liquid preparations for rectal containing medicaments. And gargles, so these are not that much important now, because even that salt water which is going to be gargled for a throat infection can be called as gargle. Concentrated aqueous solutions for external use to treat throat infection. A simple sodium chloride will do. And gels, aqueous colloidal suspension